We're here to talk about RBS, or retained blood syndrome. This is a group of drainage-related complications affecting patients following surgery on the heart, lungs, or anywhere in the chest area. So what causes RBS? Here you can see the heart and the lungs in the chest cavity. After every cardiothoracic surgery, chest tubes are placed in to drain excess blood and fluids from the surgery site. When these chest tubes are working properly, the blood flows out of the surgical site. But sometimes blood can form clots inside the tube and block the drainage of blood. When this happens, blood and fluid can accumulate around the heart and lungs, requiring the doctor to treat the condition, and it's this condition that's called RBS, or retained blood syndrome. So what happens next? Well, there are some very important changes that take place at a microscopic level. The patient's immune system responds to retained blood by recruiting extra white blood cells to the surgery site. The white blood cells release inflammatory material leading to inflammation, which can cause more blood clots, further clogging the chest tubes and making the condition worse. Even a small amount of retained blood can cause complications. In fact, 1 in 5 heart surgery patients will develop RBS. Research by cardiothoracic surgeons revealed that clogged chest tubes can cause RBS, and retained blood can cause acute mechanical damage, resulting in cardiac tamponade, or an inflammatory process that can contribute to the development of post-operative atrial fibrillation and more. So what's at stake? First off, there's increased mortality. Secondly, a higher rate of infection. Thirdly, increased cardiac arrhythmia. And increased lengths of stay within the hospital have also been associated with RBS. Any of these complications may lead to rehospitalization, delayed recovery, as well as additional surgeries. When RBS develops, there is a lot at stake for patients, hospitals, and caregivers alike. So how can you reduce or minimize it? It's called active clearance technology, or ACT. Given the steep patient toll and costs of treating RBS, medical leaders are increasingly adopting this prevention strategy. By ensuring chest tubes remain clear, serious and costly complications may be avoided. Ask your doctor about how to reduce retained blood syndrome.